The way of learning. Today's topic is components of blood, exhibited for staff nurse interns. First question is which component lack in human blood? Option A calcium, option B vitamin D, option C IgA, option D magnesium. Correct answer is option B vitamin D. Next one is the pH of human blood is between option A 6.5 to 7, option B 7.35 to 7.45, option C 8 to 9, option D 4.5 to 5. Correct answer is option B 7.35 to 7.45. Next one is the coronary care unit nurse draws an arterial blood sample to assess a client for acidosis. A normal pH of arterial blood is option A 7.0, option B 7.42, option C 7.30, option D 7.50. Correct answer is option B 7.42. Next one is blood is a option A acidic solution, option B basic solution, option C buffer solution, option D neutral solution. Correct answer is option C buffer solution. Next one is the blood contains option A 90% of water, option B 80% of water, option C 95% of water, option D 60% of water. Correct answer is option D 60% of water. Next one is which of these comprise of blood? Option A red blood cell, option B white blood cell, option C platelets and plasma, option D all of these. Correct answer is option D all of these. Next one is what is the normal blood cholesterol level? Option A more than 200 mg per dl, option B less than 200 mg per dl, option C 1000 to 1500 mg per dl, option D 500 to 1000 mg per dl. Correct answer is option B less than 200 mg per dl. Next one is which organ is called graveyard of RBCs? Option A liver, option B thymus, option C spleen, option D pancreas. Correct answer is option C spleen. Next one is bilirubin is formed from option A heme, option B globin, option C transferrin, option D gastroferritin. Correct answer is option A heme. Next question is excessive hemolysis may result in the accumulation of which substance in body? Option A bilirubin, option B minerals, option C heme, option D globulin. Correct answer is option A bilirubin. Next one is all of the following are plasma proteins found in blood except one. Option A albumin, option B globulin, option C myosin, option D fibrinogen. Correct answer is option C myosin. Next one is the protein found in blood that is responsible for transporting oxygen is option A erythropoietin, option B hemoglobin, option C gamma globulin, option D all of the above. Correct answer is option B hemoglobin. Next one is osmotic pressure is defined as option A osmotic pressure by electrolytes in cells, option B osmotic pressure caused by plasma colloids in solution, option C force within a fluid compartment, option D force outside the fluid compartment. Right answer is option B osmotic pressure caused by plasma colloids in solution. Next one is the plasma protein that maintains oncotic pressure of blood is option A fibrinogen, option B albumin, option C globulin, option D prothrombin. Correct answer is option B albumin. Next one is which is the plasma proteins that constitutes about 40 to 60% of total plasma proteins. Option A fibrinogen, option B globulin, option C fibrin, option D albumin. Correct answer is option D albumin. Next one is the principle of plasma protein responsible for exerting colloidal osmotic pressure is option A hemoglobin, option B C reactive protein, option C albumin, option D haptoglobin. Correct answer is option C albumin. Next one is albumin is one of the plasma proteins is synthesized in option A spleen, option B pancreas, option C adrenal gland, option D liver. Correct answer is option D liver. Next one is which of the following is considered as an indication for administering serum albumin? Option A formation of WBC, option B maintenance of oncotic pressure, option C formation of RBC, option D clotting of blood. Correct answer is option B maintenance of oncotic pressure. Next one is hydrostatic pressure, which passes fluid out of the capillaries, is opposed by colloid osmotic pressure, which involves option A reduced renin secretion, option B pulling power of albumin to reabsorb water, option C an increase in ADS secretion, option D aldosterone production. Correct answer is option B pulling power of albumin to reabsorb water. Next one is passing fluid out of the bloodstream, determining overall fluid movement across the capillary wall is called option A hydrostatic pressure, option B osmotic pressure, option C diffusion, option D vasoconstriction. Correct answer is option A hydrostatic pressure. Next one is the insufficiency of this substance in the blood may lead to edema of the body. Option A albumin, option B hormones, option C electrolytes, option B gases. Correct answer is option E albumin. Next one is when hemoglobin combines with oxygen, it is known as option A oxyhemoglobin, option B deoxyhemoglobin, option C reduced hemoglobin, option D oxidized hemoglobin. Correct answer is option A oxyhemoglobin. Next one is carbon dioxide combines with hemoglobin to form option A deoxyhemoglobin, option B reduced hemoglobin, option C carbaminohemoglobin, option D carboxyhemoglobin. Correct answer is option C carbaminohemoglobin. Next one is what is the name of the phenomenon that arises from the relationship between pH and oxygen's affinity for hemoglobin? Option A Boyle's effect, option B Bohr effect, option C Dalton's law, option D Henry's law. Correct answer is option B Bohr effect. Thanks for watching. Like, comment and subscribe the channel.